Senior Medical Officer Dr. Myanna Charles says a slow uptick in vaccinations has been identified as positive trends are realized in a number of cases related deaths and hospitalizations. From September 21st to present, Dr. Charles says the weekly average new cases stood at 113 before dropping steadily.
The following week it was 61, then a further drop to 31, and the last epi week, the average new cases for that week was 16. As it relates to deaths during that same period, the week of September 21st to 27th, we had an average of 55 deaths in that week. And then it declined to 27, further dropped to 18, and the last week, 9.
The medical doctor says the same pattern applied for hospitalization and the test positivity rate.
But what we did see, as the average new cases, deaths, and hospitalization improved, right, the vaccine uptake tend to decline. So as we go back to September 21st to 27th, in terms of first doses administered in that week, we had in excess of 1,200 doses. That further declined in the following week to just over 1,500 doses, and then under 1,000. And in the last week, we administered 811 doses.
The senior medical officer says a decline or delay has also been witnessed among individuals coming forward for their second dose.
Now, in regards to the AstraZeneca vaccine, now persons that lack period, that period between your first dose and your second dose, based on guidelines, manufacturer guidelines, is 4 to 12 weeks. As it relates to the Pfizer vaccine, that period is 21 to 28 days.
She says despite individuals not losing their status and the effectiveness not dropping regardless of the lapse in the first and second dose, one can only be considered fully vaccinated 14 days after receiving the second dose.
Once you received your first dose, you do not need to restart the regimen if there is a lapse in that recommended time period, right? And the two time periods, you have as much as 28 days with Pfizer and AstraZeneca 3 months. So you do not need to come back to restart your regimen if there is a delay. If the time has passed and you come forward, you will receive a second dose and you're not restarting to get another first dose.
Dr. Charles is urging Grenadians to not become complacent and get vaccinated while coupling it with the health and safety measures of wearing your mask, social distancing, and sanitization in order to prevent another outbreak. I am Gerard Joseph for GBN News.